clot form. Bite on a gauze pad firmly for 45 to 60 minutes after the extraction.
Feel it good?
If bleeding or oozing continues after you remove the gauze pad, place another gauze pad
when we record
and
this,
bite
then I'll take a
down
picture.
for
You
another
can't see anything,
45
don't worry.
to 60
Don't worry about
minutes. To protect the clot and avoid a painful condition called dry socket,
I'll go
don't do
drop you
anything
off
to
at home,
dislodge or
and then go
dissolve
pick up
the
your
clot
prescription
for
and
the
come
first
back.
24 hours.
Okay.
This means don't spit and don't suck on candies or through a straw. Don't rinse your mouth and
That was
don't brush or
fast.
floss the teeth next to the extraction site. Don't smoke
30
or
minutes?
use tobacco for at least
30 minutes?
24 hours. Avoid tobacco as much as
Okay.
possible for 72 hours or more because it slows healing and is the #1 cause of dry socket. Also, limit yourself to calm activities for the first 24 hours. This protects the clot by keeping your blood pressure lower and reducing bleeding. When the numbness from the anesthetic has worn off completely, drink lots of fluids and eat only soft, nutritious foods, chewing on the opposite side of your mouth. However, don't drink hot or carbonated liquids or eat hot or spicy foods. And don't use alcohol. To control discomfort, take pain medication before the anesthetic
paying
has worn
attention?
off, or as recommended. It's normal to experience some discomfort for several days after an extraction. To keep any swelling to a minimum, use an ice bag, 20 minutes on and 20 minutes off. After the first 24 hours, or as soon as it's comfortable, you can begin to eat normally. Resume brushing and flossing after the first 24 hours, but clean gently around the extraction site for about a week. If antibiotics are prescribed, continue to take them for the indicated length of time, even if all symptoms and
kind of
signs of infection
The
are
parting
gone.
gift you get for
After
getting your
the
whiskey
first
tonight.
24 hours, you can reduce any soreness or swelling by applying moist heat. Swelling usually starts to go down after about 48 hours. You can further reduce discomfort or swelling
I'll
after
email
the
this to
first
you.
24 hours
I'll
by
email this
rinsing your
video to
mouth very gently 3 times a day and after meals with warm salt water. Use about 1 teaspoon of salt per glass of warm water. Call us right away if you have heavy or increased bleeding, you have pain or swelling that increases or continues beyond 2 or 3 days, you develop a bad taste or odor in your mouth, or you have a reaction to the medication.